people. In this video today, I wanted to talk a little bit about healthcare inequality, medical gaslighting, and the state of the healthcare system, especially when it comes to chronic illness. Unfortunately, it's become normalised within our society to be dismissed when seeing a doctor, to wait a really long time to receive medical care, and to have quite a large diagnostic delay. Many chronically ill people wait years before they get the right diagnosis. For example, many people with POTS are misdiagnosed with anxiety or depression prior to getting the actual diagnosis of POTS, because anxiety and depression are more common, and the symptoms can resemble anxiety in a sense, racing heartbeat, feeling your heart pound in your chest, feeling sort of tremory, the lightheadedness as well, that can be mistaken for anxiety, and the fatigue seen in POTS can be mistaken for depression. But unfortunately, these misdiagnoses are quite harmful because they prevent people from getting the appropriate care. And it is just unfortunate that this is so common. For example, as well as this, studies have shown that many people with multiple sclerosis have actually been misdiagnosed prior to getting the actual diagnosis. People may be misdiagnosed with FND or told that their symptoms are anxiety again, which is extremely stressful for the chronically ill person who just needs answers as to what is going on. A survey by a women's rights charity actually found that 70% of women they asked had been told by a doctor that their illness was imagined or fabricated, aka the doctors dismissed them and didn't really believe them. And the very fact that around 70% of women are treated this way when trying to seek essential medical care is horrific. But it is such a common problem, and this is why the wait to be diagnosed with things like endometriosis is incredibly long. People wait years, again, just like with other chronic illnesses, and it should not be that way. I mean, it's good that the media is paying attention to it more. For example, I saw an article relatively recently where a woman was speaking about how instead of managing and treating her cancer, the doctor just told her to go on a picnic with her husband. That is a classic example of medical misogyny and just being dismissed and patronised even. There was another one where a woman was misdiagnosed over the phone when she actually had cancer, and this is a huge issue actually. Over the COVID period with lockdowns and everything, they switched to phone consultations, but on a phone consultation they can't always see exactly what's going on. They can't always refer for the necessary tests and things, so that obviously led to a large amount of misdiagnoses as well. And it's just horrific, really, that this has become so normalised within our society. Almost every chronically ill person I've spoken to has been dismissed or misdiagnosed at least once. A huge eye-opener for me, actually, was a couple of years ago. I started a sort of a prompt on Instagram where people can share that to their own Instagram story, and it was basically saying your misdiagnosis versus your actual diagnosis, and hundreds of people actually replied to that. And the misdiagnoses were shocking, but it just shows how common this sort of thing is, that it's got to the point where you go to the doctor and you kind of expect to be dismissed because it happens so much to so many people, but it should have never been that way. It should have never been allowed to get to that level. The reason I started disability advocacy at the age of 12 was because I'd been medically gaslit a lot, and thankfully, most people think that a 12-year-old wouldn't really understand what's going on and stuff, but thankfully I did. I knew that the doctors weren't taking me seriously and that something had to be done. So I started my first disability advocacy page at age 12 with the intention to help other people who had not been taken seriously by the doctors. But I was very frustrated because it was annoying that it was the responsibility of the patients to kind of clear up the mess caused by doctors. Because in the chronic illness and disability community, we kind of have to counsel each other to deal with the mental impact that this gaslighting and dismissal from the medical system has had on us. But it should not be the responsibility of the patients to clear up all of this mess caused by a dismissive and failing medical system. 10 years later, I'm now 22, and sadly, not much has changed. People are still getting gaslit in a horrific way. And it's kind of wild to me because it does seem like, despite passing medical school and clearly being academically intelligent, the doctors seem to come out with things that everyone else can see as ridiculous. For example, obviously this isn't always the case. There are many great doctors, but again, in terms of the medical gaslighting, the doctors can come up with some ridiculous things. For example, When I was 12 years old, I went to the doctor about, I could see this purple spirograph, a neon spirograph moving really, really fast. And I still have that now if I focus my eyes hard enough. But when I was 12, like, because it happens more in the dark, I would see it a lot. So I asked my psychiatrist about it, and they literally just said, oh, it's something in your eye. And they wouldn't consider anything else. They just said it's something in your eye. But something in your eye can't cause neon spirographs, and that are still present 10 years later. So it just feels like they dismiss it as the most ridiculous thing. And it can sometimes be dangerous. I mean, as a kid, I had overnight personality change where, you know, I became very violent, very aggressive, very defiant. And unfortunately, the doctor basically just said it was calculated and deliberate. That is in my medical files, even though it wasn't. It was an overnight personality change, which confused me and that I had no control over. And it was actually, we know now it was caused by brain inflammation and neurologically misfired signals. But the assumption that I was just a bad kid that was doing it all on purpose really harmed my self-esteem when I was younger. And that's actually why I did the TEDx talk when I was 20, called Assumption Leaves No Room for Curiosity, talking about this sort of thing where people just assume that kids are badly behaved without looking deeper. It is very dangerous, but so many doctors do this. I, on my Instagram story, asked people in the PANDAS and BANS community to say what their most common misdiagnosis was, and 60% of people said they were misdiagnosed with bad behaviour. And the fact that we live in a world where 60% of people with a serious autoimmune brain condition get misdiagnosed as just being badly behaved is shocking. But sadly, it isn't actually that surprising, because if you've lived it, you sadly know the sort of attitudes that these people in the medical system can have, and it's just awful. But, you know, it feels like there's no justice, because if you try and say to the doctor, you know, you were wrong, they don't really listen, because they think that because they went to medical school, they're smarter than everybody else and they don't need to listen to anybody else. So complaints are almost never taken seriously. And they just continue doing what they're doing because they don't want to be trained by someone who has actually been through it. They think that because they have a medical degree, they know everything. So that just keeps the cycle going. Another example of dismissal causing it to take years to get the appropriate diagnosis was with my Tourette's diagnosis. I've spoken about this a lot, of course, because I do a lot of Tourette's advocacy, but yeah, it took me 7 years to get a Tourette's diagnosis because the doctors basically assumed I would grow out of it, despite the fact that my tics had already been going on for years at that point. They just assumed a diagnosis wasn't worth it. They told me that tics won't be a part of my life forever, despite the fact that my tics were literally making it hard to walk properly. My tics had ripped my school jumper. They were making me stick out like a sore thumb in class. Teachers had questioned it. You know, my tics were utterly debilitating. They really impacted my quality of life. And I needed the recognition that my tics were significant because it was actually what was behind my OCD. It wasn't classic OCD at all. It was Tourette OCD. These rituals that I had that caused me to lose the ability to dress myself, lose the ability to walk upstairs in my home, lose the ability to even use the toilet in my home sometimes, it was all caused by premonitory urges, physical sensations, just like the ones that come before tics, making me do these rituals. So the rituals were actually more tic-based, but the doctors would never take that seriously, no matter how many times myself or my parents brought it up that this was not classic OCD. This is a tic-based issue. They never listened because they were reading out of a textbook, and they refused to acknowledge that somebody's presentation of rituals could go against what the textbook told them about OCD. And because they had read that people grow out of Tourette's and that tics are a normal part of childhood, I just never got taken seriously until like way into my teenage years. And I remember, despite the fact that my tics and stuff were as severe as I just said, the psychiatrist basically ended up saying your tics don't impact your life enough to be Tourette's, which was wrong, because to be diagnosed with Tourette's, it doesn't actually specify severity, despite the fact that my tics were severe. As I said, they'd ripped my school jumper, affected my walking, and I'd lost the ability to have any independence. Yeah, they were just very, very, very dismissive, regardless of what I said. And I had over 50 tics at that time, both motor and vocal, so I certainly met diagnostic criteria for Tourette's, but they just never took it seriously. They said there was no point referring me to a neurologist, and they lied and said that there was no neurologist that could see me in the local area. So I was left without any formal assessment for Tourette's throughout my childhood, which was very problematic, because if I had that formal assessment, I would not have had to self-diagnose, because there's a lot of stigma around self-diagnosis, but I really didn't have a choice, because it was the only way to defend myself against the discrimination that I faced from teachers and peers, and the only way to understand myself and connect with a community of people who understood me and reassure myself that I'm not a badly behaved kid. So basically, self-diagnosing with Tourette's at age 12 really saved me, because it stopped me from listening to the doctors who basically just thought I was a bad kid when I wasn't. And thankfully, by the age of 15, I finally was able to get a formal diagnosis of Tourette syndrome. But again, it shouldn't have taken 7 years. It should not have taken that much dismissal to finally get referred, because it wasn't even CAMHS who referred me. It was CAMHS who were doing all the dismissing and just never taking me seriously. I had to go to my GP, and the first referral they sent through, it got declined. It was the second one that went through. But it is such a battle to get the diagnosis that you need. But if the doctors actually took it seriously, when a private psychologist wrote to my psychiatrist when I was 10 years old saying that they wanted an investigation into my tics, I could have been diagnosed at 10 years old. But of course, they don't listen. So it isn't that simple, unfortunately. And this is the same sort of story that so many other people have, whether it's with Tourette's or something different. I saw an article relatively recently about people being forced to pay privately for a Tourette's diagnosis because they just couldn't get it under the NHS. And honestly, that's what my family should have done. But obviously, seeing a private neurologist is expensive and inaccessible to a lot of people. But it's just a real shame that you kind of have to sometimes go private to get the answers you need. Otherwise, you're going to be like me and waiting 7 years for an obvious diagnosis. And it's just ridiculous that this happens so often. So this video isn't really planned. It's more of a rant, because I don't understand why the healthcare system is allowed to be like this to so many people. For example, as well as that, the NHS isn't so good with PANDAS or PANS. I mean, they're getting better now. There are some doctors, GPs and neurologists like under the NHS who now do treat PANDAS and PANS, but they are still limited in the treatment they can give, because right now there's a lack of treatment guidelines that they can follow. So they are reluctant to give anything really strong, like really long-term antibiotics or IVIG and things like that, that are quite routinely given in some places in America. And this makes getting healthcare for PANDAS or PANS really difficult, and it's also virtually impossible as an adult to get care for PANDAS or PANS under the NHS, because they take the paediatric thing very, very literally, even though despite the name saying paediatric, that's just because that was for research purposes. When it was first discovered, it was seen as a paediatric condition, but over time, the National Institute of Mental Health actually took away the pediatric bit from the diagnostic criteria of PANS and said that PANS can impact people at any age and the onset can occur in adulthood. The name hasn't been changed yet, obviously, because it's quite difficult to change the entire name now that the condition is known as that. But yeah, it's just so frustrating that you're kind of forced to go private if you have a more complex condition like PANDAS or PANS, especially in adulthood, because the NHS just has no services for you. And thankfully there is a private service for adults with PANDAS and PANS now, but still, obviously, it's very expensive for people. And it's just a shame that so many people are let down by the system. And again, with chronic Lyme disease, it's seen as a very controversial condition. Almost no doctors under the NHS believe in it, despite the fact that over 700 peer-reviewed studies show that Lyme and the co-infections can persist despite antibiotics and therefore be chronic. I mean, if you accept that antibiotic resistance is a thing, and that infections can trigger inflammation and long-term symptoms, just like in long COVID, there is no reason to deny the existence of chronic Lyme. It isn't fair to just say to people that their condition doesn't exist, because then they're left without any care or support. And it's quite well known that if you have Lyme and it goes undiagnosed for a long period of time, then it's going to be harder to treat, because it's going to have caused some damage in the body and damage the immune system and stuff like that. So it really shouldn't be seen as controversial to say this. Because like, I tested positive for Lyme. I've been treated for Lyme for just over a year now, and it basically saved me, because prior to that, my symptoms were so severe that I genuinely felt like I was dying. I struggled to breathe, my skin was yellowed, I was very, very, very ill, and the treatment hasn't cured me, but it's certainly helped. And people like me need recognition that chronic Lyme exists so that we can get long-term treatment, because without that long-term treatment, you know, I would be much, much worse off. But that long-term treatment is not available under the NHS, so we are forced to pay out, which thankfully I am able to now. But it's just not fair that people are forced to pay for treatment that they so desperately need. Because it's said that in the UK we have universal healthcare, but I don't actually think we do. we are lucky, obviously luckier than America, that if we have a terrible accident, we can get treated for free, which is amazing. And obviously myself and hopefully everyone else is very grateful for that. But when you have a complex chronic illness, it just feels like there's no services for you under the NHS, so you really have no choice but to go private. So it doesn't feel all that universal when it comes to complex chronic illnesses. Moving on to medical inequality, as an autistic person, my autism diagnosis should not get in the way of receiving appropriate medical care, but unfortunately it has, to the point where I actually considered trying to get my autism diagnosis removed from my medical file because I thought that it would get doctors to take me more seriously, despite the fact that I am autistic. But obviously, if it was going to negatively impact my healthcare, I was concerned by that. But I cannot get my autism diagnosis removed because it is on almost every medical letter I have, so it's not possible to erase. But it's just wild that people are having to consider removing certain diagnoses because of the way doctors treat us when we have that diagnosis. And I swear it caused so many problems in my life. Not the autism diagnosis itself, but the way doctors react to it. Just over a year ago, almost 2 years ago, I had a neurology appointment where I spoke to them about pain in half of my head, neck pain, muscle issues like severe muscle fatigue, where I need to use a wheelchair and my muscles cramp at the slightest thing. I need to eat frequently, episodes of loss of sensation, all of this stuff. And I also spoke to them about how in the past infections would trigger loss of coordination and stuff like that, and how my vision would sometimes go yellowish. But instead of, actually doing appropriate medical assessments, within 5 minutes they decided that this was all part of autism, when it's not. Autism doesn't cause all of that. And it's quite dangerous to assume that, because autistic people are not immune to any other condition. Autistic people can have other conditions too that are completely unrelated, so it's not right to assume that everything is part of the autism, but unfortunately that is what they did. And it was dangerous because my muscle weakness at that time, my muscle fatigue was so severe that I could barely breathe sometimes and I could barely swallow sometimes. I would cough a lot when trying to eat and drink. And it made me feel like there was no hope or help for people like me, because if you have an autism diagnosis, it's like you're just immediately dismissed. And I'd waited a year for that neurology appointment, and within that year of waiting, I felt like I'd nearly died multiple times because of the breathing issues and stuff. So obviously it basically traumatized me, and I'd get flashbacks if something reminds me of it. Even now, I get into fight or flight because I was made to feel like there was no hope and that I was just going to die with no answers. And it definitely harmed me financially because I had to spend over £1,000 on private healthcare to get answers, because there was no way I could wait another year under the NHS just to be dismissed again. I didn't think I could go another year physically. So yeah, it's just awful that if you have an autism diagnosis like me, you're kind of afraid to seek care from the NHS because of the way doctors assume that everything is part of autism and just gaslight you in that way, without considering any other possibility. And it was quite therapeutic in a way, because I was able to contact another autistic person who had been dismissed in exactly the same way by the same doctor as me, the same neurologist, and it nearly led to their death. Thankfully they are alive, but the very fact that the neurologist made me feel like I was about to die and basically traumatized me and almost killed another autistic person, yet they're still allowed to keep on doing this to other people, it does feel like there's no justice. And that's why, as a person who's autistic, I feel like I have to go private, because if I go private, it's the only way they won't automatically see autism on my medical file, because that's on my NHS file, and it's the only way I can get taken seriously without my autism diagnosis getting in the way. But of course that is very expensive, to be forced to go private all the time because you're autistic. And the NHS should be a safe service for everyone to use, regardless of whether they're autistic or not. But sadly, the assumptions that a lot of doctors make, just because the autism is right at the front of your medical file, it really does impact the medical care that you receive. And I know other autistic people who have been through the same thing. Obviously I can't go in depth about other people's experiences, obviously, but I know a lot of other autistic people who have been through this sort of thing and who have serious conditions that could be life-threatening, that were misdiagnosed as being a sensory processing issue. The doctors basically say that, it's your brain processing things differently, there's nothing really wrong, when there actually is something really wrong. Or they say autistic people are very prone to anxiety, it's probably all anxiety. And that's just so dangerous to assume that, because actually autism often co-occurs with physical conditions like Ehlers-Danlos syndrome, POTS, and other conditions as well, like neuroimmune issues. Quite a lot of autistic people have ME/CFS. So yeah, assuming that it's all part of autism is dangerous, especially as a lot of autistic people, it's thought that around 25% of autism cases are syndromic, and that basically means that the autism is a feature of a wider genetic or chromosomal condition. For example, Fragile X syndrome, tuberous sclerosis. Tuberous sclerosis is a condition I was assessed for when I was 12 because it can cause autism traits, but they're actually caused by like tumors in the brain, and it can cause loads of other symptoms as well. So that's why I was assessed for that. But the very fact that autism can be associated with these wider chromosomal conditions, I can't say that properly, but these wider genetic conditions means that doctors should consider those other things rather than just blaming everything on autism. They should know that autism is associated with some fairly serious medical issues. For example, again, epilepsy is more common in autistic people. So the very fact that doctors don't take us seriously is just disgusting, honestly. But yeah, it really feels like nothing can be done. I hate to say that, because obviously I do try very hard to make the world a better place for neurodivergent people. That's why I do advocacy and stuff. But it feels like with the doctors and everything to do with the medical system, if you try to give them training or if you try to make a complaint, you're never taken seriously, because they kind of have the belief that, well, they're the one with a medical degree, they can do no wrong and everyone else is wrong. If you make a complaint or say to them that they're wrong, they just think that you're hysterical or whatever, you know? So it's very difficult. I don't think we can necessarily improve the doctors, which I hate to say that, but they seem very stuck in their ways. So I think all we can really do is empower people who have been through these sorts of experiences to know that if their doctor has told them that there's nothing wrong, but they still feel like this is something wrong, they should get another opinion, because that reassurance might not actually be true. I was reading a review of a relatively local hospital earlier, their neurology department, and one of the reviews actually broke my heart, because it was said that their husband went for a neurology consultation, was told there was nothing wrong. They believed it because they believed the expert, but then they died 4 months later because there actually was something seriously wrong. So this happens way too often. I feel like if you feel like there's something wrong and the doctor tells you there's not, get another opinion, because they might be wrong, unfortunately. That isn't to scare people, obviously, it's just because if you feel like there's something wrong, there very well could be, and it's safer to get another opinion than, well, you know, it's better to be safe than sorry. And sometimes that other opinion, though, can't come from the NHS. I mean, it can sometimes, but with complex conditions like with chronic Lyme, the NHS were never going to realise that I had that, because it is unfortunately seen as controversial, despite the fact that it is evidence-based. As I said, studies do show that antimicrobial resistance exists, and that's why the Lyme bacteria can persist in the body. Autopsy reports from people with Lyme also show the same thing, where even after over a decade of antibiotics, the bacteria is still alive and metabolically active in the body. So, you know, you can get another opinion under the NHS. However, sometimes you do have to go private, but if you can't afford that, then you can sometimes get an individual funding request. An individual funding request is where the NHS covers consultations and treatments that they usually wouldn't cover, but in exceptional circumstances. I know some people who have had success with that for various assessments and treatments and things that aren't routinely covered by the NHS. And then, as well as that, there are charities that can help fund Lyme disease testing. For example, there's the Limelight Foundation, and I want to say, I can't remember all of them, but I'm going to link some of them because they're really important. Some of them do cover Lyme treatment, like they give Lyme treatment grants to people in the UK as well as in other countries too. So I think that that sort of thing can be really, really helpful if you're struggling under the NHS. There's also something that I was considering. I think it's the National Migraine Centre, because I suspect I might have some kind of migraine disorder, because as I said, I get the pain in one side of my head, episodes of like muscle fatigue on one side when I have that head pain, increased dysautonomia symptoms, like all those things can be quite typical of migraine, dizziness as well, light sensitivity. So The National Migraine Centre, basically, they're not run by the NHS, but they can offer either free or reduced appointments. There is a waiting list, but because it's charity funded. But it's quite messed up that we live in a society where we need charities to fund medical care because the NHS is failing so much, and because the so-called universal healthcare system isn't actually universal. But I am obviously very grateful for these charities. But sadly, that's kind of the way we're going. We are having to have charities cover the cost of medical care because the NHS doesn't provide the care that we need. But yeah, that's sad. I'm not 100% sure what I hope to get out of this video because, again, it's a bit of a rant, but I think that it all needs to be said. I think the main thing that I can give you from this is to just know that it's okay to get a second opinion. In fact, I probably recommend it sometimes. Because there are so many people who get misdiagnosed. Another issue is like the misdiagnosis of functional neurological disorder. FND is a real condition, but the problem is that a lot of doctors assume it's psychological or like psychosomatic, and although stress can make some symptoms worse, you wouldn't say heart attacks are psychosomatic just because they can be triggered by stress. You wouldn't say high blood pressure is psychosomatic just because it can be triggered by stress. Studies actually show that people with functional neurological disorder have raised levels of inflammatory markers, showing that this is actually a physical thing. And as well as that, functional MRI scans do show that these symptoms are real. The brain is not functioning correctly. But I think the issue with an FND diagnosis is it says that your nervous system isn't functioning, but it doesn't always say why. And, you know, sometimes the best recommendation they can give is psychological therapy, even though that isn't going to get to the physical root. Physical therapy is sometimes used, but that is not helpful for all symptoms. Like, physical therapy cannot help with things like dizziness or eyesight issues that come from it, or it can't always help the paralysis or fatigue. Like, it doesn't help everybody, basically. It can't help every single symptom. And I know a lot of people who were diagnosed with FND because doctors kind of just assumed that, oh, they're a young woman, they're anxious, their nervous system stopped functioning, it's FND, when that was actually quite dangerous for them because, for example, I know many people with PANDAS, PANS, and autoimmune encephalitis who are misdiagnosed with FND. Neurological Lyme is often misdiagnosed as FND, many reports of that. I know some people who had issues where their body couldn't process certain nutrients and that was damaging the nervous system, but it was misdiagnosed as FND. I know some people who were misdiagnosed as having FND, but their symptoms went away with B12 injections because B12 deficiency can actually cause severe neurological symptoms. And it's just like genuinely heartbreaking. And, you know, a lot of doctors have actually spoken out about this and have said that they aren't sure how helpful an FND diagnosis actually is because they've seen a lot of cases where people were misdiagnosed with FND and it was actually something else. And it is quite scary because, yes, there are tests that can kind of separate FND from other things, such as they can check certain things with your muscles and stuff, but at the same time, sometimes people pass those tests as having FND, but it's actually the thing that's caused their nervous system to stop functioning is a physical thing, so it's totally different than what the doctors seem to think it is. And as well as that, FND can co-occur with other conditions, so to assume that everything is FND is wrong because there are many people who have both things like FND and multiple sclerosis, and multiple sclerosis is physical, just like FND is, but, you know, doctors are dismissive, they don't understand that sort of thing. But to assume that everything is FND and not rule out things that could co-occur with FND or occur instead of FND is really dangerous because, as I said, I know so many people who have been misdiagnosed, and I'm actually afraid to see a neurologist in case they say everything is FND because I know that it's not. But I know that because I'm a young woman, they'll probably assume that it's all FND, especially as my symptoms are very complex, and there is nothing wrong with an FND diagnosis if it is correct and if the interventions for FND actually help you and if an FND diagnosis allows you to understand yourself. But the problem is that too many people are being misdiagnosed when we know it's not FND, especially in like the Lyme and PANS community. I know so many people who were misdiagnosed with FND when they had Lyme, and that's what I was afraid of, but thankfully I was able to go private and find out that I do have Lyme. And Lyme treatment has helped reduce some of my neurological symptoms by about 25%, so I'm incredibly grateful for that. But unfortunately, that care just isn't available under the NHS. This is an article written between the 1910s and 1920s, so it is around 100 years old, and it's about how patients can feel frustrated at a functional diagnosis because doctors didn't understand it back then. It says, in time, he also loses the respect of his patient, as to his ability at least, and the whole situation becomes impossible. The case is labelled functional, neurotic, hysteric, or whatever name it happens to be fashionable to apply to what is not understood. As a matter of fact, the headache of nervous origin should be quite easy to distinguish from the functional headache due to disorder of the body. The cause of the latter may sometimes escape us and its treatment may fail, but it is nonetheless physical. This doctor understood functional symptoms and the fact that they were physical and that they shouldn't be dismissed, and that it can be really frustrating for the patient. This was over 100 years ago, and a lot of doctors today still don't understand this. That was my rant. I just wish that something could be done to improve the healthcare system. I wish I could be some kind of advocate and help change the healthcare system for the better, but it just seems like no one is listening and the doctors just keep doing what they're doing. They go by the textbook when their textbooks might be out of date. Interestingly, a lot of people assume that doctors keep up with the latest scientific evidence, but a lot of them are so busy that they can't. They are overworked as it is. A lot of doctors, unfortunately, just don't really have the time to look at all the latest research on every single condition. And this is why you still meet a lot of doctors who will say pandas and pans don't exist, despite the fact that they do. When I was a kid growing up, it was as if pandas and pans were dirty words when seeking medical care. And in some cases, they still are seen as that, which is the point I'm trying to make. But, in the past, it was seen as controversial or theoretical. And unfortunately, some doctors still haven't moved past that sort of mindset, despite the fact that obviously more research has been done since then. Pandas and pans are recognised as existing by the International OCD Foundation, Harvard, Stanford, Yale, etc. But a lot of doctors don't realise this. They're just going by what they were taught in medical school a long time ago because they have never had the time to do further research. And for example, this is also an issue with myalgic encephalomyelitis, also sometimes referred to as chronic fatigue syndrome, although that is a very dismissive name because it's a lot more than that. People in the medical field, unfortunately, used to think that ME was psychosomatic, which was extremely dangerous to people with the condition because that sort of psychosomatic label caused people to not get the appropriate medical care, and it caused people to be forced into exercise programs, which actually made them worse because post-exertional malaise is a key feature of ME. And if people with ME are exercising, that actually has been proven to increase abnormal protein buildup in the muscles, increase inflammation, and use too much cellular energy. Because a lot of people with ME struggle with mitochondrial dysfunction. Mitochondria is basically what gives you energy in your cells. So labeling it as psychosomatic is very dangerous because it pushes people into these programs that actually make them worse, and it just causes people to get gaslit constantly because they would kind of assume that people are faking in a way, or they're afraid of exercise when it's not a fear. People with ME desperately want to be able to get out, live a normal life, and exercise, but they can't because they are too ill. They've had to make sacrifices for their health and give up certain things, so to imply that it's a choice is disgusting and honestly quite sadistic. And to say that people are gaining anything from it, like they used to do the secondary gains argument, like you're gaining something for being ill. Again, saying that people are gaining anything from an illness which has taken everything away from them, it is sadistic, it is wrong, it is disgusting. Thankfully, scientific research, as I've said, it has come forward, it has improved, it has progressed. We now know that ME is a physical condition, it is systemic, it is associated with inflammation, it is associated with mitochondrial dysfunction, it is associated with abnormal protein buildup in the muscles, and it is associated with even hypermobility. But to be fair, that's probably people with hypermobility spectrum disorder and hypermobile Ehlers-Danlos syndrome who have been misdiagnosed. But there are many physical factors associated with these symptoms. And despite the scientific evidence showing this, a lot of doctors still aren't even aware of this. A lot of doctors have not taken up the training offered by ME organisations, and studies have shown that doctors in A&E, for example, they seem to think that ME is psychosomatic, which is so dangerous. If they get a patient in who has ME, who is very, very ill, physically ill, because it's a physical condition, they're going to assume that it's psychosomatic, which prevents them getting the care that they so desperately need. So this is a huge issue as well. Doctors don't have the time to look into every aspect of these conditions. They don't take up training offered by organisations because they don't have the time. And I just wish that the medical system could change and that doctors could get very regular mandatory training on conditions that are often misunderstood, like ME, Ehlers-Danlos syndrome, mast cell activation syndrome, POTS, PANS. POTS and PANS sound so funny together. It does, I know. I have POTS and PANS, and it's so awkward when I tell people my diagnoses and they're like, huh? They're kitchen utensils. But anyway, that's, there's a lot of conditions that are often misunderstood, and it would be so great if doctors could have mandatory training in these conditions. But I feel like they don't, because they just don't really understand these conditions very much, because if they are trained on it, then they're not listening. And that's just really, really problematic. And I also wish that doctors could have mandatory training on, understanding the impact that gaslighting and dismissing their patients has on their patients, both physical and mental health. It has a huge negative impact, and I feel like a lot of doctors don't seem to understand that. But to be fair, it isn't always entirely the fault of the doctors themselves. I mean, some of them do just, they just don't listen. But others are, I think, overworked and they don't have the time for training. And for example, when I was at the hospital once, I was lining up to get some food in the little cafe they had. I think it was maybe Starbucks or something. And one of the doctors was also queuing up, and he looked really stressed. You could tell because his jaw was really tense, and he was grinding his teeth, and he just looked angry and really stressed. And he was waiting in line, but then he couldn't. He just had kind of stormed off because he didn't have even the time to wait in line and get lunch. So I kind of felt bad for him, but I also felt bad for his next patient because what if he takes that out on his next patient? But at the same time, I do feel bad for the doctor themselves because they clearly don't even have time for a lunch break. So I think in some ways the mistreatment that patients face from doctors, obviously it is wrong, it shouldn't be allowed, but sometimes it's the result of the doctors being overworked and not even getting the support themselves. So it's a very difficult thing, and I think the healthcare system just needs a complete overhaul. It needs to be changed completely, and I don't know how it can change, but it needs to change, because doctors should have mandatory training. They should not be overworked to the point where they're angry and they take that out on their patients. And they should not be allowed to blame everything on autism and make people afraid of seeking healthcare because they have an autism diagnosis. And yeah, I just wish something could be done about this, but I'm not fully sure if it can, which is not good to say. I hope it helps you know that there are other options. You can have a second opinion. If you're not able to get the care you need under the NHS, there are sometimes charities that can give grants and help, and charity-run medical centres. And sometimes the NHS can give an individual funding request where they can cover treatments that they usually wouldn't cover. Yeah. Sometimes changing your GP surgery can be helpful if it's your GP surgery you're having issues with. This was an issue for me, although I can't change my GP surgery because literally all the ones in my local area have a low rating. But it's quite difficult because my GP surgery was basically rated as requires improvement by the Care Quality Commission. But sometimes people find that changing their GP surgery is helpful if you feel like there's no way you can get an appointment, or there's no way that you can be listened to, because sometimes it's just that certain GP surgeries aren't as good as others. That might be an option for you. And if it's not, then you might be able to do what I did, which was when I was not being taken seriously by my GP surgery whatsoever, they refused to refer me to endocrinology, and I was afraid to speak to them about my high heart rate and blood pressure dysregulation because I was certain they would just label it as anxiety. I actually just went to the walk-in centre once when I was really ill, and the tests there found that I did have a high heart rate, high blood pressure and high temperature. And from that, the doctor there was amazing, and he spent an hour with me, which is a lot in a walk-in / urgent care centre, because they usually don't spend that long with anybody. But I was extremely grateful because they were able to sort out the healthcare that I was receiving because I was being failed. And that doctor at the walk-in centre actually phoned my GP surgery and said to them, you have to refer her to endocrinology, because at that time, the walk-in centre doctor thought I might have a pancreatic tumour. Thankfully I don't, but obviously that's a suspicion that needs to be looked into. So he basically demanded that my GP surgery call me on Monday because I was afraid to make an appointment with them, because when I had done in the past, the GP receptionist had shouted at me for answering a question literally because I'm autistic, So this walk-in centre doctor tried to make an appointment for me, and he demanded basically that I be referred to endocrinology because it'd be dangerous if I wasn't. And, you know, I love that doctor. I don't know what his name was, but he was great. And it was kind of funny because when he was on the phone to my GP surgery, he was like rolling his eyes, which was funny because that's literally how I feel when on the phone to them as well. But thankfully, he did get me the care I needed. I got referred to endocrinology. I got referred to cardiology because of him, which led to me getting my POTS diagnosis. And he also moved my neurology appointment forwards because they wanted me to wait for over a year. But seeing as I was having breathing difficulties and swallowing issues, that was dangerous. Although, to be fair, the neurology appointment itself didn't go well because they blamed everything on autism. But still, I'm very grateful for that walk-in centre doctor. So if you can't get the care you need under your GP surgery, sometimes you have to go to the walk-in centre because they can sometimes like phone your GP surgery and basically demand that you're referred to certain services. And you know, that was really, really helpful to have their support. So there are other options. I don't want people to feel like it's completely hopeless because, you know, that hopelessness is very dangerous. It is difficult to get the healthcare you need, but sometimes you just have to go down a different avenue. And it really shouldn't be that way. But for now, until we have a complete overhaul of the NHS where it can work better, this is the kind of thing we have to do, find another way in any way that we can.